So here I have a scout image. Basically, it's a KUB for the radiologist to look at to make sure that the patient followed the proper instructions and to see if the large colon has been properly cleaned out. Here the patient is in the right lateral decubitus. Central ray is at the mid-sagittal plane at the iliac crest, at the level of the iliac crest, and the structures you see is the entire colon, and there would be air in the medial side of the ascending colon and on the lateral side of the descending colon. Here I have a right lateral rectum. Central ray would be at the mid-coronal plane at the level of the ascus. Patients laying on their right side. And structure seen here is a rectosigmoid area. Here we have an RIO position. Central ray is 1 to 2 inches from the midline of the elevated side at the level of the iliac crest. Patient is rotated 35 to 45 degrees, and structures seen here would be the right collet flexure with less superimposition than on the left side. Here we have a PA position. Central ray is the mid-sagittal plane at the level of the iliac crest. Patient is in a prone position and slightly in a trendless blur position to help prevent over the lapping of the small bowel. Structure seen would be the entire colon. Here we have a PA axial position. Central ray is at 30 to 40 degrees caudat and center at the mid-sagittal plane of the level of the ascus. Patient is prone. Structure is a rectosigmoid, but the superior region of the large colon may not be included. Here we have the patient LAO position. Central ray is 1 to 2 inches from the midline from the elevated side at the level of the iliac crest. Patient's prone but rotated 35 to 45 degrees. The left colic flexure is seen and will be the one less superimposed over the right. Here we have the left lateral decubitus. Central ray is at the mid-sagittal plane at the level of the iliac crest. Structure seen is the entire colon, but the air would be at the medial side of the descending colon and lateral side of the ascending colon. Here we have a post-evac image of the patient. This image is taken once the patient has gone to the bathroom and flushed everything out. We want to make sure that the majority of the contra has been flushed out. And some of the instructions that you need to tell the patient is that drink plenty of water because it might cause constipation, and to not be alarmed if your stool is white. So lots of water in the next 24 to 48 hours.